Okay, great. Sorry for the technical situation that had happened, but I promise we'll run along the course. So let me start by introducing myself. My name is Dermatology. I'm an R4 dermatology resident from the joint program here in Riyadh, Saudi Arabia. And I'll give you a quick overview on the dermatology residency program. So just a quick overview on what dermatology is all about. So it's basically about skin, hair, nail, and visible mucous membranes. You're going to be exposed to over 3,000 diseases. It goes way beyond the surface. Usually when it comes to dermatology, there's a strong clinical variation. So you can deal with things like, for example, vitiligo, acne, psoriasis. Patients can live with it. They can become celebrities. But sometimes it's very critical and you'll have to deal with them in an ICU setting. So what I want to say is that it's not always pretty and easy. The type of practice when it comes to dermatology, it's 100% an outpatient oriented service. Later on, you can choose a career path where you want to be an academic or, for example, working in a governmental hospital, or later on, maybe even work in private clinics. There are a lot of subspecialties. So you have general, medical, pediatrics, hair, nail, immunology. This is just a short list of subspecialties of the subspecialties. It's very broad and very general. Now, there are a lot of pros and cons when it comes to dermatology, it's just like any field. When it comes to the pros, you never sleep in the hospital. And this was a very important thing to me, honestly. So if you're the kind of person that doesn't want to sleep in, this is a great specialty for you. You're covering clinics, you have regular known working hours, you're dealing with all ages, you rely on your clinical diagnostic skills. It's 100% a visual field, so you need to be very sharp when you come and observe and assess your patients. It's very rewarding. So let's say if you're not curing someone, you're controlling the disease most of the time. It's rarely a life-threatening situation, but it does exist. You get to expose both yourself to both medical and surgical options. Great opportunities for the cons are usually you're going to have to read. You're bound to read at home. There's a really big patient load when it comes to the clinics. And most importantly, at your level, you're exposed to a lot of competition and the seats are very limited. I'll talk you through the Saudi Board of Dermatology. It's been established in 1997. It's a 4-year program and it's supervised by the Saudi Commission for Health Specialties. As students and interns, this is the most important thing you need to know. This is not updated. You need to be constantly on the update and on the look for the updated list. But what I want you to understand from this slide is that you really need to make sure you know what the dates are for exams, for interviews, etc. And you need to make sure you fulfill the CV points to the maximum, to whatever fits your potential and whatever you can do and finish ahead of time. Let's say 4th, 5th year of medical school, and then complete whatever is missing during internship. This would be ideal, but you can always complete everything during your internship year. So stay in the lookout for the updated lists. Again, this is not an updated one. It's just a model for you to understand what I'm talking about. So in general, when it comes to the dermatology program, you need to understand that we have different seats and positions. So the most important thing you need to understand is that we have the Saudi Commission as the main supervisor, and that's where you apply. But then you're divided into 2 pathways. You either decide to go for the joint pathway and you keep on rotating every 3 months in the 7 hospitals that are part of the joint pathway, or you decide to go for the KQH pathway where you stick to the hospital. But it's very important to know that it's interchangeable. So let's say you're in the joint program, you're allowed to do a 3-month elective at the KQH program and vice versa. The only difference is at the very end, the part 2 examination, and I'll come to the details of these things. Usually you have to conduct the Saudi board exam if you're in the joint or the KQH program. The plus is that in the KQH program, you become a double board certified. So you have the KQH fellowship alongside the way. So that's just something you have to put in mind when you're applying. And it depends, do you like to rotate in hospitals or you like to stay in one hospital? This is very important. Another important update in the joint pathway is that the KAMC, what's known as Al-Haras commonly, is now a separate program on its own. They have their own program, but they're part of the joint in some rotations. However, it's a complete different separate program starting next year. So you have to put that in mind when you're trying to apply. Are you applying to the joint alone, or the joint but you're doing Al-Haras, or you're doing the KQH pathway? The positions usually are, when it comes to seating, this is the approximation, okay? So they don't usually exceed 18 seats, 4 seats at KKUH, 14 at the joint program, give or take +2, -2, but this is the range usually. The percentage of 2020-2021 was 84.56. However, the percentage of this year, the people who recently graduated, it's 100% above 86. So it's increasing by the year, and it's becoming tougher by the year. So I don't have the exact cumulative of this year, but I know for sure it's above 86. So for whoever is applying for next year, you need to make sure you get a score that's definitely higher than 86. So just a quick tip for anyone who's going through interviews or they need something to rely on. Usually make sure you plan out your electives. So if you want to do it in the joint versus KKUH, you need to really know where you stand exactly and which one you want, because that's the thing that's going to determine who will likely accept you more. Research is extremely important. Voluntary work, conferences, practices, and also recommendation letters are super important. What is this program? So what is it and what is expected from this program? Usually when you go into the dermatology program, you're expected to be exposed to basic sciences of the skin, pharmacology and therapeutics, clinical diagnostic skills, dermatological procedures, dermatopathology, dermatosurgery, phototherapy, and laser. And these are all either part of elective rotations or core rotations, which you're bound to be exposed to them at some point during your 4-year residency program. The nature of training is very important. You need to understand that it's an outpatient-oriented setting. The only time you're going to really have an inpatient bedside teaching is when you're on call and you're doing rounds, for example, with your attending. Teaching activities are variable if you're in the joint versus non-joint, but the standard is we have 2 activities per week. One of them is for pathology and one of them for the dermatology purely. When it comes to journal club, morphology sessions, it depends based on the center you're rotating at. So each hospital has their own system. So wherever you're rotating, they have a schedule that's fixed or that's interchangeable, and then you go accordingly. You must participate in research projects. So in order for you to graduate the residency program and to sit the Part 2 examination, you need to have a published research in your residency. In addition to, of course, attending educational meetings and workshops. So all in all, just to simplify this for you, as an R1, usually you're doing internal medicine, pediatrics, plastic surgery. The new update in the R1 is that in the past, they did not used to have dermatology. Nowadays, they have dermatology. So this is a good thing. You're doing 2 months of dermatology as an R1, so more exposure. The good news also in R1 is that they usually don't have a promotion exam, and it's not mandatory to take the Part 1 examination. So it's kind of a good flexible year to get to understand what you're dealing with. But we do recommend taking the Part 1 as an R1. As an R2, you start pure dermatology, you cover on-calls, and this time you have to do the Part 1 examination and you have to sit the promotion exam. Similarly, in R3, otherwise you cannot be promoted to senior year, which is in our case R4. In R4, this is the final year, so you don't have a promotion. You only have a board examination to sit for. During your R3, R4 year, you have the elective months. These are good months for you because you get to explore, let's say, dermatosurgery or whatever field you're interested in, and you get to rotate elsewhere, like wherever you want to rotate, you get to explore and see. So when it comes to the consultations and on-calls, we differ from other specialties in the sense that we cover a full week on-call. So if I'm on-call this week, I cover it from Sunday until Saturday, 24 hours. But they change the terminology. So in the morning, it's called consultation, and after 4 p.m., it's called an on-call or home on-call service, basically. So you don't have to sleep, but if you're called, you're probably going to have to go to the hospital and see your patients. We differ from KKUH is that in KKUH, it's divided. So there is a group that covers the morning shift and there's a group that covers the PM shift. This is the thing that differs between the joint and KKUH. In the joint, no, you're covering 24/7 and there's no shifts. Vacation wise, we have our annual leaves. This is a 4-week thing. We have an educational leave, which is like a 1-week thing. And then you get to choose one of either aids. One of them you'll be on call and the other one is just free for you to enjoy and chill. So when it comes to an income outcome situation, it depends really on where you stand, like in terms of the ladder. Are you working in a private sector or governmental or both maybe? What's your subspecialty? It definitely differs when you come across these things. And how would you juggle it with your personal life? It really depends on how you schedule yourself and how you do it. So some people can multitask, others will need to learn how to multitask. But all in all, it's very doable and easily conducted, I hope. So this is pretty much what it's all about. So you can always contact me via email. You can DM me via Twitter if you want to. I'm always active. Make sure if you're still a student or an intern, you can join the Derm Club. Usually they announce for major events or activities or voluntary work. They can also guide you, check their YouTube channel. They usually have good beneficial things for you. So thank you so much for your time. If you have any questions, please feel free.
يعطيك العافية دكتورة، ما قصرتي، شكرا جزيلا. في بعض الأسئلة إذا ممكن أطرحها عليك.
تفضلي.
طيب أول شيء do you deal with burns؟
ممكن تعيدين السؤال بس بليز؟
يسألون do you deal with burns؟
Do we deal with burns? No, burns is plastic surgery. We deal with first degree burns. لو جانا في الكلينيك we can definitely deal with the first degree burn. You know, like it's completely fine. Like in any second degree burn and above is usually plastic surgery oriented.
جميل. طيب where can we find research opportunities?
That's a great question. So research, usually it depends what kind of research are you interested in. Most of the times you should contact either the consultant directly. If you have a consultant you're in a good relationship with, you can approach and ask them right away. If that's not the case, the best type of people to ask for are usually the junior residents, R1 and R2, because that's the time they start taking on projects. It's not wise to ask R3, R4 because they're busy and they're either finalizing whatever research they have or they're busy with their promotions and board exams. So the best person to get a research opportunity from is either to talk to the consultant right away or residents, especially R1, R2.
جميل. طيب is summer electives as students helpful؟
ما أدري أنا هل في أحد جالس يتكلم لأنه ما قاعد يوصلني ترى صوت.
أيوة بس توني طرحت السؤال. هل السمر electives للطلاب مفيدة أو مو مفيدة؟
100%. شوفوا this is a general rule not only for dermatology. If you're into a specialty, في specialty معين you like, start early, start من سنة ثالث طب. سووا summer elective عشان you get to either rule in or rule out. So always go for it حتى إذا كانت not official. يعني if مثلا let's say ما في opportunity and you're trying to يعني to do it بس مثلا there are no slots available أو مثلا تقفل عليكم التسجيل أو they don't accept students, you can sometimes do something else. يعني you can do a twist إنكم تروحون لل consultant directly and you ask them to shadow. عرفتوا؟ يعني you tell them I want to shadow you just to explore and see do I want this or I don't want this. This is very helpful at year 2 and year 3. And I started doing them when I was سنة ثالث طب and it was the best thing I've ever done. So I wasn't looking for the certificate or proof that I've done an elective. لا, I wanted to truly explore do I أصلا like this field or not. So it helped me eliminate a lot of subspecialties before going into dermatology. And then later on at سنة خامس سنة رابع when it's the official time where أصلا it's scheduled in your curriculum to do the electives, you make the official one for the thing you truly want, which will help you later on for CV. But the earlier you do it, the better.
جميل. طيب what are derma surgeries?
Dermatological surgery is usually it's a broad topic honestly, but usually يعني it's excisional, it's simple excisional procedures. We do things like Mohs surgery, simple excisions. They're all clinic oriented or clinic based usually.
جميل. طيب how to stand out in interviews?
Sorry?
How to stand out in interviews?
So Shufi, I will tell you something. The secret is usually when you make it to the interviews, you're almost there, like you 99% made it. The only thing is that you need to be yourself. So do not pretend to be someone else. Do not take someone else's words or someone else's way of conduct. Try and be yourself. The more natural you are, the more yourself you are, the more you're going to stand out. So they don't usually ask any weird question. They ask questions that are found in your CV. So you need to just answer, be relaxed. I usually tell anyone who asks me, like the really, really good trick I usually recommend is the first question is usually the hardest question. And the first question is usually introduce yourself. So what I usually tell people is memorize this question by heart, because usually the you know, like your stimulation and the palpitations and everything happens during that question. So if you get that covered and you answer it, because you already have it like in the back of your head, all the butterflies will go away. You're going to be relaxed to respond and reply to the other simple questions they ask. Because the thing is, when it comes to the interviews, all they want to see is that, are you the kind of person they want to work with? Are you the kind of person that's collaborative? Do you have a nice personality? Or are you the kind of person that's going to create a trouble later on when we join, you know, like when you interact with the residents or when you interact with the physicians? So that's the only thing, that's the whole purpose. Are you a person that's going to add to the program, or are you a person that's going to create trouble to the program? So if you be yourself, trust me, it's going to go as smooth as ever. The only thing I would recommend is just memorizing that first question to get rid of the chills, you know.
جميل. طيب دكتورة، هل في تشبع في تخصص الجلدية بالمستشفيات الحكومية؟
Oh, you'll always have an opportunity. Subhanallah, it depends on the situation and the time. إذا الحين هذه السنة في تشبع، السنة الجاية يمكن ينفتح. It depends on the position. So أبدا, this is not something that should stop you. يعني definitely don't rely on this. انتوا اللي تسوون انكم تسعون وتقدمون وتنقبلون، الباقي بعدين هذه لها حل. لو في تشبع كان يقفل البروجرام.
جميل. طيب how to show interest during the internship?
So في الانترنشيب you need to understand شيء مرة مهم. يعني شوفوا, you cannot just come into the clinic and stare. Usually you want to take initiative, and you try to interact, ask a question if you want to ask a question, and show you're interested. If you can cover a clinic, ask if you can cover a clinic. And the worst thing that's ever going to happen is someone telling you, no thank you, it's already covered, or we have enough number of residents. So what I would recommend is show interest. If they have activities and you guys can present a topic, go ahead and do that, to experience, you know, presenting in front of people. If they can allow you to cover clinics, that's great, because you get to experience the feel of it and you get to explore it. Usually you ask the consultant